session on epidemiology. Now, what we are going to deal with today is what we call as the epidemiological approach. How do we study diseases, health-related states or events in epidemiology? Now, the essence of understanding this approach lies on two facts. One is asking questions and second is making comparisons. People always complain that epidemiologists ask too many questions. But when we talk of asking questions, it's about to get to the root of the problem or the disease. So let's look at what is meant by asking questions and what are the questions we do ask to learn about facts related to a condition or a disease. So please do remember 5 W's. Now if we understand these W's, it's quite easy rather than memorizing them. So let's look at what are these 5 W's. With reference to a condition or a disease, the first W is what is the condition, right? Next is who are the people who have been affected by the condition. Now if you look at the disease SARS, which we have discussed earlier, when it came in first, it was questionable as to who is being affected by the disease the most, whether it is the young people or the old children or it's the adults or the elder adults or so on. So the second W is who are being affected. Next comes in where is this disease occurring the most or where is the condition being found most commonly, right? So we have dealt with 3, what, who, where. Next comes in when. There are certain diseases which occur during specific time periods. There are certain other diseases which are present all throughout the year. Let's take an example. If you look at respiratory tract infections affecting children, they are very commonly found when there is a seasonal change, where hot changes to cold or suddenly hot changes to rains and so on. So when there is change in the atmospheric temperature or the environmental conditions, certain diseases may be seen having higher occurrence as compared to other times of the year. So when we are talking of when, we are talking about the time specification of the disease. And the last W is looking out for the cause of the disease. Why is this disease occurring in the given time, at a given place, and in which individuals? So if we look at the 3 W's which I mentioned about who, where and when, we are talking about person, place and time distribution. So please do remember, time, person, place distribution is very important when we talk about any particular disease. Now these 5 W's refer to diseases or conditions. Once we know what is the root cause of the disease or what is happening about the disease in a particular place or around the world, we need to look at how do we deal with it. So the question with reference to dealing with a particular health-related condition or disease is how, the H. How do we deal with it? How to curtail it? How to eliminate the disease? How to eradicate the disease? These are small terminologies which we are going to look at in the further sessions. But as of now, we just need to understand, in the epidemiological approach, we begin with trying to get answers to the 5 W's. Right. Having asked these questions and got answers to these questions, the next step is to make comparisons. Now when we talk of comparisons, what are we trying to compare? Let's look at an example. If we find that there are 100 cases of dengue in a particular area, we try to look out for why in this particular area, that means the place which we are talking about, why in a particular time of the year have certain people being affected. Right. Now in the same area there would be other people who may have not been affected. So we may want to compare why in this group of people dengue has occurred, whereas in the other group there's no dengue. So this is what I mean by making comparisons. Another important point when we talk about making comparison is we need to compare like with like. In other words, we need to compare apples with apples and not apples with oranges. Now what do I mean by this? If you are looking at occurrence of a disease in a particular country, for example, so if 100 people have been affected by a certain disease in Malaysia, for example, and 500 people have been affected by the same disease in China, can we say from these numbers or this magnitude of numbers that occurrence of the disease is higher in China as compared to Malaysia? We have to give a thought to it. It's not that easy to compare Malaysia with China just on the basis of the number of people being affected. Reason being, we also need to look at what is the population from which these people have been affected. What I mean by that is, when we look at the denominator, because we are trying to find out who amongst the bigger group have been affected, we look at the population of Malaysia. It's less as compared to China, which is definitely the most populous country in the world. So if you're trying to make comparisons about number of people affected in Malaysia and China, you cannot just go by numbers. You have to take the total population into account. If we fail to do that, we are not making the appropriate comparison, which in turn would result in results which are fallacious. So, in a nutshell, what we have learnt now is that the epidemiological approach starts by asking questions and getting answers to them. Having got the answers, we try to make comparisons to check out if these results are valid or not. So that's all from me for today, and I'm ready to take a coffee break. I will be happy to see your comments, and please do subscribe to our channel. Bye-bye.